Half of men over 50 wake up 3 times a night to pee. Weak stream. Never feel empty. You know what most do? Ignore it until they need a catheter shoved up there. I have been a urologist for 15 years and I am tired of seeing this. Here is what actually works. 3 specific foods shrink your enlarged prostate naturally. No drugs. No surgery. First results in 4 weeks. But 90% of you eat these foods completely wrong. That is why you see zero improvement. Today I am giving you the exact protocol, what to buy tomorrow, how to cook it, and the third food that works like natural finasteride but without killing your erection. Stay with me because if you get this wrong, you're wasting your time. My name is Dr. Max, 15 years as a urologist, and I have spent the last 5 years studying how diet affects prostate health. You know how many patients come to me with bags full of supplements from the internet? Hundreds. Palmetto, beta-sitosterol, pygium. $70 a month and they get 0 results. Then I put them on these 3 foods, cooked the right way. Within 6 weeks their symptoms improve. Better stream, less night trips, no side effects. I have tracked this in over 300 patients. This is not theory. This is clinical evidence from my own practice. So when I tell you these 3 foods work, I am not guessing. I have seen it, measured it, documented it. Now let me show you why most men fail with this approach. Here is what actually happens to your prostate after 45. Your testosterone converts into DHT, dihydrotestosterone. This hormone makes your prostate cells multiply. Year after year, the gland gets bigger, presses on your urethra, that narrow tube carrying urine from your bladder. First you notice the stream is weaker. Takes longer to start. You push a little. No big deal, right? Wrong. This is the beginning. 6 months later, you are up twice a night. Another 6 months, 4 times a night. Your wife asks if you are okay. You lie. Say it is just getting older. But you know something is wrong. You just hope it goes away. Spoiler alert. It does not go away. Ever. Let me tell you about Robert. 53 years old. Came to my office after 2 years of worsening symptoms. 2 years. You know what he did during those 2 years? Googled his symptoms. Read forums. Bought supplements from internet ads. Drank cranberry juice. Did absolutely nothing that actually works. His prostate was 55 grams. Normal is 20 grams. 55. He could barely empty his bladder. Had 300 milliliters of residual urine sitting there all day. Breeding ground for infection. I asked him why he waited so long. He said he thought it would get better. He thought it would get better. Listen to me carefully. It never gets better on its own. Never. Not in 15 years have I seen enlarged prostate shrink by itself. Not once. And here is what nobody tells you about ignoring this. 3 things happen. Bladder damage from constant overstretching. Kidney damage from back pressure. Or acute urinary retention. That is when you cannot pee at all. Emergency room. Catheter shoved up your penis. Sometimes surgery to cut out part of your prostate. All because you waited. All because you thought some $70 bottle of Palmetto from Amazon would fix it. Now here's the part that frustrates me the most. I have patients taking 5 different supplements. Palmetto, beta-sitosterol, pygium, pumpkin seed extract, stinging nettle. You know how much they spend per month? $150. You know how much it helps? 0. I measure their prostate size. I check their flow rate. I test residual urine. Nothing changes. Nothing. Then I put them on these 3 foods. Cooked the right way. Within 6 weeks their symptoms improve. Better stream. Less night trips. Bladder empties properly. No side effects. No $100 monthly bills. So why do these 3 foods work when supplements do not? Because food is not a concentrated extract in a capsule. Food is a complex matrix. Multiple compounds working together. Fiber, healthy fats, antioxidants, minerals, vitamins. Your body knows how to process real food. It has been doing it for millions of years. Supplements? Isolated compounds. No supporting nutrients. Poor absorption rate. And most are garbage quality anyway. Made in factories with no quality control. Half the time you are not even getting what the label says. But here is the part that makes me angry. Most men already eat these 3 foods. They're in your kitchen right now. You just eat them completely wrong. Raw instead of cooked. Without the right fats for absorption. At the wrong times. And then you wonder why nothing changes. Why your symptoms keep getting worse. I am going to fix that for you right now. I am going to show you exactly how to eat these 3 foods. What to buy tomorrow. How to cook it tonight. How much to eat. And why the preparation method makes all the difference between results and wasted effort. Because if you do this wrong, you will be back here in 6 months telling me nothing worked. And I will tell you the same thing I tell everyone. You did not follow the protocol. You got lazy. You cut corners. And your prostate does not respond to half measures. Food number 1. Tomatoes. And 90% of you are eating them completely wrong. You throw a slice of raw tomato on your sandwich. You add cherry tomatoes to your salad. You feel healthy. You think you are doing something good for your prostate. Wrong. You are wasting your time. Here is what you need to understand about tomatoes. Inside this red fruit is a compound called lycopene. It is one of the most powerful antioxidants for prostate health that exists in nature. It protects your prostate cells from damage. It reduces inflammation. It slows down the growth of prostate tissue. Studies show that men who consume high amounts of lycopene have 25% fewer symptoms of enlarged prostate. 25%. Better urine flow. Less nighttime trips. Less pressure. Just from one compound. But here is the problem. When you eat raw tomatoes, your body absorbs almost zero lycopene. The lycopene is locked inside thick cell walls. Your digestive system cannot break them down. So that lycopene goes straight through you into the toilet. You know what breaks down those cell walls? When you cook tomatoes, heat ruptures the cells and releases the lycopene. Now your body can actually absorb it. Cooked tomatoes have 10 times more available lycopene than raw tomatoes. But wait, it gets better. Lycopene is fat soluble. That means it needs fat to be absorbed into your bloodstream. No fat, no absorption. Simple as that. So here is the exact protocol. Listen carefully because this is the difference between results and wasted effort. You need cooked tomatoes with healthy fat, tomato sauce with olive oil, tomato paste in your eggs with butter, roasted tomatoes drizzled with olive oil. That is it. That is the protocol. Let me give you specific examples. Tomorrow morning, make scrambled eggs. Add 2 tablespoons of tomato paste. Add 1 tablespoon of olive oil or butter. Cook it, eat it. Boom. You just gave your prostate a massive dose of bioavailable lycopene. For lunch or dinner, make pasta with tomato sauce. But not store-bought sauce full of sugar. Real tomato sauce. Crushed tomatoes, olive oil, garlic, herbs. Or take fresh tomatoes, cut them in half, drizzle olive oil on top, roast them in the oven for 30 minutes. Simple. Delicious. And actually works. How much do you need? Minimum 3 to 4 servings of cooked tomatoes per week. A serving is half a cup of tomato sauce, or 2 tablespoons of tomato paste, or 4 to 5 roasted tomato halves. Now here is what I see in my practice. I tell patients to eat more tomatoes. They come back 6 weeks later. Nothing changed. I ask them how they are eating tomatoes. They say raw in salads. Every single time. So let me be crystal clear. Raw tomatoes do almost nothing for your prostate. Cooked tomatoes with fat shrink your prostate. That is the difference. That is what 15 years of clinical experience taught me. And here is the bonus. Tomato paste is concentrated. 1 tablespoon of tomato paste has more lycopene than 3 whole raw tomatoes. So if you want maximum benefit with minimum effort, tomato paste is your friend. 2 tablespoons in your morning eggs. Done. You just hit your daily target. But tomatoes only address inflammation and cell damage. They do not stop DHT production. That hormone I told you about earlier. The one that actually makes your prostate grow. For that, you need food number 2. And this one blocks the enzyme that creates DHT. It is probably in your fridge right now. But you are eating it raw, just like the tomatoes. And just like the tomatoes, that is the wrong way. Food number 2. This one actually blocks the hormone that makes your prostate grow. And you probably ate it for dinner last week. Raw. In a salad. Completely wrong. Cruciferous vegetables. Broccoli. Cauliflower. Brussels sprouts. Cabbage. All of them. Now listen carefully because this is where it gets interesting. Remember DHT? That hormone I told you about? The one that makes your prostate cells multiply? Well, DHT does not just appear out of nowhere. Your body creates it. From testosterone. Here is how it works. You have an enzyme called 5-alpha reductase. This enzyme takes your testosterone and converts it into DHT. More DHT means bigger prostate. Simple as that. Drugs like finasteride block this enzyme. You know what else blocks this enzyme? Cruciferous vegetables. For free. No prescription needed. No side effects like erectile dysfunction. Inside broccoli and cauliflower are 2 compounds, indole 3-carbinol and sulforaphane. These compounds are natural 5-alpha reductase inhibitors. They slow down the conversion of testosterone into DHT. Less DHT production means less prostate growth. Studies show that men who eat cruciferous vegetables regularly have 40% lower risk of prostate enlargement. 40%. Just from eating vegetables your grandmother told you to eat. But here is where 90% of you mess it up. You eat raw broccoli. You throw raw cauliflower in your salad. You think you are being healthy. Wrong again. Raw cruciferous vegetables are hard to digest. Your body cannot extract those beneficial compounds efficiently. You need to cook them, but not too much. Overcooking destroys sulforaphane. You need that sweet spot. Here is the exact protocol. Steam your broccoli or cauliflower for 3 to 4 minutes. That is it. Not 10 minutes. Not until it turns to mush. 3 to 4 minutes. It should still have a little crunch. Still be bright green. Why steaming? Because boiling leaches the nutrients into the water. And then you pour that water down the drain. Genius move. Steaming keeps the compounds in the vegetable where they belong. Now here is a trick that boosts sulforaphane by up to 4 times. Add mustard seeds, or wasabi, or horseradish. These contain an enzyme called myrosinase. This enzyme activates sulforaphane and makes it way more bioavailable. So here is your complete protocol. Take 1 cup of broccoli florets. Steam for 3 to 4 minutes. Drain. Add olive oil. Add crushed mustard seeds or a tiny bit of wasabi. Mix, eat. Done. You just gave your prostate a natural DHT blocker. Do this 5 times a week minimum. 1 cup of cruciferous vegetables, properly steamed, with the mustard trick. That is your target. Let me tell you about James. 57 years old. PSA was climbing. Prostate was 40 grams. I put him on this protocol. Steamed broccoli 5 times a week. Cauliflower 3 times a week. Added the mustard seeds like I told him. 6 months later, his PSA dropped. Prostate size stable. No growth. Symptoms improved. He told me he hated broccoli his whole life. But when I explained it is either broccoli or finasteride with possible erectile dysfunction, he suddenly learned to love broccoli. Funny how that works. Now I know what some of you are thinking. But Dr. Max, I do not like broccoli. I do not like cauliflower. Too bad. Eat it anyway. This is not about your taste preferences. This is about your prostate not crushing your urethra shut. You can hide it in other foods. Chop it fine and mix it into ground meat. Blend steamed cauliflower into mashed potatoes. Add it to soups. Be creative. But get it in your body 5 times a week minimum. And if you really cannot stand cruciferous vegetables, there is a supplement called DM, diindolylmethane. It is concentrated in dole 3-carbinol. But guess what? It costs $40 a month. And it is not as effective as real food. So stop being a baby and eat your vegetables. So now you have 2 foods. Cooked tomatoes with fat for lycopene and inflammation. Steamed cruciferous vegetables with mustard for DHT blocking. That is 2 out of 3. But food number 3 is the most powerful. This one works on 3 different levels at once. It reduces inflammation like tomatoes. It provides critical minerals your prostate needs. And it has been shown in studies to improve urinary symptoms by 30% in just 8 weeks. And I guarantee you are not eating enough of it. Food number 3, the most powerful one. And most of you eat fish maybe once a month if that. Big mistake. Fatty fish, salmon, mackerel, sardines, herring, not white fish, not cod or tilapia, fatty fish. There is a huge difference. Let me explain why this matters. Your prostate sits in a constant state of low-grade inflammation after 45. Think of it like a slow-burning fire inside your pelvis. This inflammation makes the prostate swell. The swelling presses on your urethra, and you end up standing at the toilet for 5 minutes waiting for something to happen. Now, most inflammation in your body comes from omega-6 fatty acids. They are in vegetable oils, processed foods, fried foods, everything you eat at restaurants. These omega-6 fats tell your immune system to create inflammation. More omega-6 equals more inflammation equals bigger prostate. Omega-3 fatty acids do the opposite. They are powerful anti-inflammatory compounds. They tell your immune system to calm down, stop attacking, reduce swelling, and fatty fish is the richest natural source of omega-3 that exists. Two specific omega-3s matter here: EPA and DHA, eicosapentaenoic acid and docosahexaenoic acid. You do not need to remember those names. Just remember fatty fish. Here is the research. Harvard followed 20,000 men for 10 years. Men who ate fatty fish 3 or more times per week had 30% lower progression of prostate enlargement. 30%. Just from eating fish. Another study measured prostate size and inflammation markers. Men who consumed high amounts of omega-3 had significantly smaller prostates and better urinary flow compared to men with low omega-3 intake. But here is what shocked me in my own practice. I had patients taking fish oil supplements. Expensive ones. $60 a bottle. Their inflammation markers barely moved. Then I switched them to real fatty fish 3 times per week. Within 8 weeks, their inflammation markers dropped. Symptoms improved. Stream got stronger. Why? Because real fish is not just omega-3. It is protein, vitamin D, selenium, zinc, all working together. Your body evolved to process whole foods, not isolated compounds in capsules. So here is your exact protocol. 100 to 150 grams of fatty fish minimum 3 times per week. That is a palm-sized portion. A normal serving. Best choices ranked by omega-3 content. Wild salmon. Highest. Mackerel. Very high. Sardines. High plus you eat the bones, which gives you calcium. Herring. High. Rainbow trout. Good. Worst choices. Farm-raised salmon-fed corn and soy. Low omega-3. High omega-6. You are better off not eating it. Tilapia. Almost zero omega-3. Might as well eat chicken. How to cook it. Bake it. Grill it. Pan-sear it in olive oil. Do not deep fry it. You know why? Because deep frying in vegetable oil adds omega-6 back in. You just defeated the entire purpose. Genius move right there. Let me tell you about David. 61 years old. Prostate 52 grams. Waking up 5 times a night. Exhausted. Depressed. His inflammation marker, C-reactive protein, was 8.4. Anything over 3 is bad. 8.4 is terrible. I put him on this exact protocol. Wild salmon 3 times a week. Sardines twice a week. Cooked tomatoes daily. Steamed broccoli 5 times a week. No changes to his medications. Just food. 8 weeks later we retest. C-reactive protein dropped to 2.1. His nighttime urination went from 5 times to twice. His stream improved. He actually smiled in my office. First time in 2 years I saw him smile. That is the power of real food. Not supplements. Not internet magic pills. Real food prepared correctly and eaten consistently. Now I know what you are thinking. But Dr. Max fish is expensive. Yeah, it is. You know what else is expensive? Medications. $50 a month for tamsulosin. $80 a month for finasteride. $150 for supplements that do not work. Fish is cheaper than all of that combined. And if money is really tight, sardines are $3 a can. Loaded with omega-3. Eat them twice a week. Problem solved. Stop making excuses. Here is another trick. If you absolutely cannot stand fish, take a high-quality fish oil. Not the cheap stuff from the drugstore. Get one that is third-party tested for mercury and contaminants. Look for minimum 1,000 milligrams of combined EPA and DHA per serving. But I am telling you right now, real fish works better. Every single time. Your body knows the difference. So let me recap what we have covered. 3 foods. Cooked tomatoes with olive oil for lycopene and cell protection. Steamed cruciferous vegetables with mustard seeds for DHT blocking. Fatty fish 3 times a week for inflammation control. Do these 3 things consistently for 6 weeks. Not 5 weeks. Not 3 times a week fish, then skip 2 weeks. Consistently. 6 weeks minimum. And here is what you can expect. Week 1, nothing changes. Your body is adjusting. Week 2 may be slight improvement in stream. Week 3 night urination starts decreasing. Week 4 flow gets noticeably better. Week 6 you realize you slept through the night twice this week. Week 8 you feel like a normal human again. But only if you do it right. Only if you follow the exact protocols I gave you. Not your version. Not the easier version. The version I just explained. Now let me show you how to put this all together into a daily eating plan that actually works in real life. Because knowing what to eat means nothing if you do not know when and how to eat it. Now let me show you how to put all 3 foods together into one day. Because this is where 90% of you will screw it up. You will try to improvise. You will skip steps. You will think you know better. Do not improvise. Follow exactly what I am about to tell you. Here is your breakfast. 2 whole eggs. 2 tablespoons of tomato paste, 1 tablespoon of olive oil or butter. Scramble them together. Cook it. Eat it. Done. You just hit your lycopene target for the day. Takes 5 minutes to make. And before you say you do not like tomato in eggs, too bad. Your prostate does not care about your taste preferences. Eat it anyway. Mid-morning snack if you are hungry. Greek yogurt. Some berries. Or just skip it. You do not need to eat 6 meals a day. That is bodybuilder nonsense. Lunch. This is where the fish comes in. 150 grams of salmon. Bake it. Season it with salt, pepper, lemon. Side of steamed broccoli. 3 to 4 minutes steaming. Drizzle olive oil on the broccoli. Add crushed mustard seeds. Eat. That is meal 2. You just got your omega-3. You got your cruciferous vegetables with the mustard trick. And it took you 15 minutes total to prepare. Afternoon. Do not snack unless you are actually hungry. Most men eat out of boredom. Drink water instead. Your bladder will thank you. Dinner. Here's where you mix it up. Maybe grilled chicken breast. Side of cauliflower. Steamed. For minutes. Olive oil. Mustard seeds again. And a big salad with olive oil and tomato-based dressing. Or skip the chicken. Make a big pot of tomato-based vegetable soup. Throw in cauliflower, carrots, celery, crushed tomatoes, olive oil. Eat 2 bowls. Simple. Effective. The pattern is simple. Every single day, you need cooked tomatoes with fat. Every single day, you need cruciferous vegetables steamed properly. And 3 times per week minimum, you need fatty fish. Write that down. Every day tomatoes. Every day cruciferous. 3 times per week fish. That is your minimum. Not your goal. Your minimum. Now here is what you need to eliminate. And this is not negotiable. Red meat. Cut it to once per week maximum. It increases inflammation. High-fat dairy. Cheese. Whole milk ice cream. All of it promotes prostate growth. Refined carbs. White bread, pastries, sugary cereals. They spike insulin, which triggers prostate cell growth. And alcohol. I know you do not want to hear this, but alcohol irritates your bladder and prostate. It makes you pee more. It worsens all your symptoms. Cut it to twice per week maximum. Or better yet, eliminate it completely for 3 months and see what happens. Now let me tell you what to expect week by week. Because if you do not know what is normal, you will give up too early. Week 1. Nothing changes. You feel the same. Your symptoms are the same. This is normal. Your cells are adapting. Do not quit. Week 2. Maybe you notice the stream is slightly stronger. Maybe. Or maybe you're imagining it. Keep going. Week 3. Night urination starts to decrease. Instead of 4 times, now it is 3 times. That is real progress. That is your prostate inflammation dropping. Week 4. Flow definitely improves. You are not standing there as long. The stream has actual pressure. You empty your bladder better. Week 5 and 6. You sleep through the night twice this week. Twice. When was the last time that happened? This is when you realize, holy shit, this actually works. Week 8 to 12. Symptoms stabilize at this new improved level. You feel normal again. You stop planning your life around bathrooms. You stop waking up your wife at 3 a.m. But only if you do it right. Only if you are consistent. Not 5 days a week, then skip the weekend. Every single day. No exceptions. No cheat days. Your prostate does not take days off from being inflamed. Let me tell you about Marcus. 59 years old. Did everything I told him for 4 weeks. Then he went on vacation. Said, screw it, I am on vacation. Ate steak every night. Drank wine. Came back and all his symptoms returned. Took him another 6 weeks to get back to where he was. Do not be Marcus. Do not waste your progress because you want a vacation from your health. Your prostate does not go on vacation. Now I know some of you are thinking this sounds like a lot of work. It is not. It is 15 minutes of cooking twice a day. If you do not have 15 minutes twice a day to cook food that keeps you out of surgery, then I cannot help you. And here is the reality nobody wants to hear. This is not a 6-week fix and you are done. This is how you eat now. Permanently. Because if you go back to your old diet, your symptoms come back. Every single time. Think of it like brushing your teeth. You do not brush your teeth for 6 weeks then stop. You do it every day forever. Same thing here. But here's the good news. After 3 months, this becomes automatic. You stop thinking about it. You just do it. It becomes your new normal. And the benefits compound over time. Your prostate stays healthy. Your symptoms stay under control. You avoid medications. You avoid surgery. You sleep through the night. You pee like a normal human being. All from eating 3 foods correctly. Now food is 80% of the solution. But the other 20% matters too. And most men completely ignore it. That is movement, stress management, and one habit that is slowly destroying your prostate every single day. Let me explain what I mean. Food is 80% of the solution. But if you ignore the other 20%, you are wasting your time. Let me explain what I mean. First, movement. You sit all day at work. You sit in the car. You sit at dinner. You sit watching TV. Then you wonder why your prostate is inflamed. Your pelvis has 0 blood flow. 0. When you sit for hours, blood pools in your pelvic area, creates pressure, creates stagnation, and stagnant blood means inflammation. It is that simple. Here is what you need to do. Minimum 30 minutes of walking every single day, not 3 times a week. Every day. I do not care if it is raining. I do not care if you are tired. Walk. And every hour you are sitting, stand up for 5 minutes. Walk around. Do some squats. Shake it out. Your prostate needs blood flow. Give it blood flow. You know what else helps? Kegel exercises. Yeah, I said it. Men need Kegels too. Not just women after childbirth. Men with prostate problems absolutely need them. Here is how you do it. Contract your pelvic floor like you are stopping urination midstream. Hold for 5 seconds. Release for 5 seconds. Do 15 reps 3 times per day. Morning, afternoon, night. This strengthens your pelvic floor muscles. Better muscle tone means better bladder control. Better urinary flow. Less dribbling. Takes 2 minutes 3 times a day. No excuses. Second, weight. If you are overweight, your prostate is suffering. Every 10 kilograms of extra weight increases your risk of prostate problems by 20%. 20% per 10 kilograms. Why? Because fat tissue produces estrogen. More fat equals more estrogen. More estrogen signals your prostate to grow. It is a vicious cycle. You do not need to become a bodybuilder. Just lose the belly. Get under 25% body fat. Your prostate will thank you. Your testosterone will thank you. Your wife will thank you. Third, stress. Chronic stress is killing your prostate. When you are stressed, your body releases cortisol. Cortisol triggers inflammation everywhere, including your prostate. You need to manage stress. I do not care how. Meditation, deep breathing, exercise, therapy, whatever works for you. But ignoring stress and hoping it goes away does not work. Never has. Never will. And sleep. 7 to 8 hours minimum. Not 5 hours because you stay up watching YouTube. Not 6 hours because you think sleep is for the weak. 7 to 8 hours. Your body repairs itself during sleep, including your prostate. Now here is the habit that is slowly destroying your prostate. And 90% of you do it without even realizing it. Holding your pee. You are in a meeting. You need to pee. But the meeting is not over yet. So you hold it. You are driving. You need to pee. But the next rest stop is 30 minutes away. So you hold it. You are watching a movie. You need to pee. But you do not want to miss anything. So you hold it. Stop. Doing this. When you hold urine for extended periods, you stretch your bladder. You create back pressure on your prostate. You force your bladder to work harder. Over time, this weakens your bladder muscles, makes incomplete emptying worse, increases residual urine. Here is the rule. When you need to pee, go pee. Within 10 minutes. Not in an hour. Not when it is convenient. Within 10 minutes. Your bladder and prostate are not designed to hold urine for hours. They are designed to empty regularly. Let them do their job. Let me tell you about Frank. 54 years old. Truck driver. Held his pee for hours every single day because he did not want to stop driving. Came to me with severe urgency and frequency. His bladder capacity was shot. Muscles weakened. I told him the same thing I am telling you. Stop holding your pee. He said, but Dr. Max, I am a truck driver. I cannot stop every hour. I said, then find a new job or accept that your bladder is going to fail. Harsh? Yes. True? Also yes. He made changes. Planned his routes around rest stops. Stopped drinking coffee while driving. Used empty bottles when necessary. 6 months later, his symptoms improved dramatically. Sometimes you need to change your lifestyle to fix your health, not the other way around. Now let me give you one more factor that most doctors will not tell you. Frequent ejaculation helps prostate health. Yeah, I said it. Regular sexual activity or masturbation keeps prostatic fluid flowing, prevents stagnation, reduces inflammation. Studies show men who ejaculate 4 to 7 times per week have lower rates of prostate problems. 4 to 7 times per week. Not once a month. Not when you feel like it. Regularly. Now I am not telling you to go crazy. I am telling you that regular sexual activity is actually beneficial for your prostate. It is not just for fun. It is for health. So let me recap the lifestyle factors. Walk 30 minutes daily. Stand up every hour. Do Kegel exercises 3 times a day. Lose the belly fat. Manage your stress. Sleep 7 to 8 hours. Stop holding your pee. And maintain regular sexual activity. Do these things along with the 3 foods we talked about, and your prostate will respond. I have seen it hundreds of times in my practice, but you need to do all of it. Not just the food, not just the exercise. All of it together. Because your body is a system. Everything affects everything. Now let me tell you what happens if you do everything I just explained. And what happens if you do not. Because you need to understand both sides. Let me paint you 2 pictures. 2 different futures. You get to choose which one you want. Picture 1. You follow this protocol. Every single day for 6 weeks. Cooked tomatoes with olive oil. Steamed cruciferous vegetables. Fatty fish 3 times a week. You walk 30 minutes daily. You stop holding your pee. You do your Kegel exercises. Week 4 you notice the stream is stronger. Week 6 you sleep through the night twice. Week 8 you realize you have not thought about your prostate in 3 days. That is when you know it is working. 3 months in this becomes your new normal. You do not even think about it anymore. You just eat this way. You move this way. And your prostate stays quiet. No symptoms. No problems. No emergency trips to the bathroom during meetings. 6 months and you go for your checkup. Your urologist measures your prostate. It is smaller. Your flow rate improved. Your residual urine dropped. He asks what you did. You tell him you changed your diet. He does not believe you. But the numbers do not lie. 1 year later, you are living a normal life. You sleep through the night every night. You pee once in the morning with good strong flow. You do not plan your life around bathrooms anymore. You have energy. You feel like yourself again. That is picture 1. That is what happens when you do this right. Now picture 2. You watch this video. You think, yeah, that makes sense. But you do not do anything. You keep eating the same way. You keep sitting all day. You keep ignoring the symptoms. 6 months from now, your symptoms are worse. You're up 5 times a night. Your stream is weaker. You cannot empty your bladder completely. You start getting bladder infections. Your sleep is destroyed. You're exhausted all the time. 1 year from now, you are sitting in a urologist office. Not me. Some other urologist who does not care about your diet. He prescribes tamsulosin. $50 a month. It helps a little. Not much. Your mouth is dry all the time. You feel dizzy when you stand up. But at least you can pee a bit better. 2 years from now, your prostate is bigger. Medications are not working anymore. Your urologist mentions surgery. TURP. Transurethral resection of the prostate. They go up through your penis with a scope and cut away prostate tissue. Recovery is 6 weeks. Possible complications include erectile dysfunction, incontinence, and retrograde ejaculation. But you have no choice at this point. That is picture 2. That is what happens when you do nothing. Which picture do you want? Because you are choosing right now. Not tomorrow. Right now. If you want picture 1, here is what you do today. Right now. Before you close this video. First, open your notes app. Write down these 3 foods. Cooked tomatoes with olive oil. Steamed cruciferous vegetables 3 to 4 minutes. Fatty fish 150 grams 3 times per week. Second, make a grocery list. Tomato paste. Fresh tomatoes. Broccoli. Cauliflower. Salmon. Olive oil. Mustard seeds. Write it down right now. Third, tomorrow morning make those scrambled eggs with tomato paste. Do not skip it. Do not make excuses. Just do it. Fourth, schedule an appointment with your urologist. I do not care if you think you are fine. Get checked. Get your PSA tested. Get a prostate exam. Know where you stand. And fifth, subscribe to this channel. Because I am going to keep giving you protocols like this. Real medical advice that actually works. Not supplement ads. Not clickbait. Real information from 15 years of clinical practice. Next week, I am releasing a video on pelvic floor exercises for men. The exact technique that fixes erectile dysfunction and improves urinary control. Step-by-step demonstration. You are going to want to see that. Now, let me be clear about something. I am not a miracle worker. I cannot fix your prostate through a YouTube video, but I can give you the information and the tools. What you do with that information is up to you. Some of you will follow this protocol. You will see results. You will message me in 3 months saying, "Dr. Max, you changed my life." Those messages make this worth it. And some of you will do nothing. You will keep eating garbage, keep sitting all day, keep ignoring the warning signs. And in 2 years, you will be scheduling surgery. I cannot help you if you will not help yourself. This is not complicated. This is not expensive. This is not impossible. 3 foods, cooked correctly, consistently. That is it. Your prostate can heal. Your symptoms can improve. You can sleep through the night again, but only if you actually do something. So, what is it going to be? Picture 1 or picture 2? Normal life or surgery? Health or medications? The choice is yours. Make it count. I am Dr. Max. This is Real Urology, for real men who want real results. See you in the next video.